In this module, we are going to discuss how to set up your tray for your service. It's very important that you are following safety and sanitation laws and rules. And so first of all, you are going to make sure that your tray or whatever you're putting your tools on has been disinfected with a hospital grade disinfectant and something that is approved by OSHA. I then have put on a drape that has a plastic backing to protect the tray. And you'll see that I have sections on the tray. So I have my section for designing the brow, and once the brow is designed, these items will be removed. I have a tray that is protected with plastic. It also has been disinfected. And this is where we are going to keep our wet or our items that we're going to be using during the treatment. We do have a garbage right below the tray here. Sometimes people do attach a biohazard bag to the tray, and that's fine as well. But of course, our cartridges, any needles that we work with are always disposed of in a sharps container. And then I do have my equipment. So let's talk about what we have on the tray here for our design. We do teach the golden ratio, and we use a string method as well as caliper for duplicating the second brow. So I have some already charcoaled string here. It's a mapping thread. You can also use just regular thread with some of your wax pencil on it. Obviously, this is convenient to work with. I have a little spoolie, which you can dispose of after, or you can give that to your client. And I'm going to use this for brushing the brows up and down, and then going ahead and trimming any excess hair that might fall outside of my design. And that's so important for you to do when you're doing your permanent makeup service and mapping the brow, is to get rid of that extra hair. So now that I've finished with trimming any long hair, any hair that lies outside of the design that we've done, we can then go ahead and use a little personal razor to clean up any peach fuzz around the brow, any little tiny hairs on the top or in the very front that lie outside of our line. We're not taking a lot of hair off unless we have discussed this with our client first, but it will make such a difference in your work and in your design to clear the area so that you're working with a nice straight outline and you end up with a nice straight line. We then have our wax drawing pencil. I have a black here. They also come in shades of brown. We would recommend that you have several pencils sharpened, and you can even have 2 or 3 of them on your tray in case they break or get dull. It's very hard then to draw a nice clean line. And I do have a safety razor here to sharpen the wax pencil. This is a caliper, and the caliper is going to be used to actually duplicate the exact design on the second brow. So we design the first brow. We then go ahead and get the client's approval, and then we will take measurements to duplicate on the other side. And literally we'll be putting pencil on the back of the caliper to help us draw the lines. This is a wonderful tool to have, and you will use it a lot. I sometimes personally even use it during my procedure just to make sure that the length of the brow is staying the same, the width of the brow is staying the same. So it is something that you might use during the procedure as well if needed. We have our numbing product. Now this is a pre-numb, and in the anesthetic module we talk about the differences between your pre-numb and your secondary number. This is a cream form with predominantly the base of lidocaine. This is what we'll use after we have designed the brow and have marked the brow. We'll use a Sharpie or liquid eyeliner works as well to mark the brow. And then we'll go ahead and put our number on. And the easiest way to put the number on is to just put a little bit on the brow and then roll it down the brow. We don't want to disturb our design at all. And then when it comes time to remove it, we can just take, again, another little microfiber applicator, and we can wipe that off, just slide that off. It's so important to maintain your design. You take all that time to do it. You mark it with your liner or marker, and you don't want to mess it up with your numbing procedure. I forgot to mention earlier, we do clean the brow, of course, first with an alcohol prep pad. Sometimes clients come in with their eye makeup on. We may have asked them to do that, and we can use an eye makeup remover to remove that. But then also always follow with either an alcohol pad or some kind of antibacterial cleanser or wipe to keep that area very sanitary and safe for the procedure. So once we finished our mapping, we're going to go ahead and move that off the tray. We then have our equipment, and you'll see that today we're doing ombre brow. So you will see that I have wrapped it in a clip cord. These coverings, this plastic covering is clip cord. Some people actually do wrap with barrier film, and that's fine, but it's very hard to get off. And then I have taken some athletic wrap and just wrapped it around the top so that that stays on and I have a good grip. We also have a bit of barrier film over the top of our power source. When you're going into this, just think about anything that you might be touching during the procedure and things you don't want to contaminate. And of course, you would always be disinfecting your equipment afterward as well. Last but not least, I have my working tray. So I have set out 2 different cartridges that I'm going to work with. And then I have a little bit of plastic here. This is nice for putting down your little pigment cups. You can take a little bit of Vaseline and put on the bottom, and you can put your pigment cups there. You can use those cups for your secondary number. That's another way to use those. I have my green soap that I'll use for cleaning the pigment off the skin, and I've used a glove. I've used a nitrile glove, put that over the top of it, and then just tied it securely. And all I have left out is a little bit of the nozzle, which you won't be touching. So you'll position your hands this way. And then when it comes off, we'll go ahead and wipe that. I have both Q-tips and microfiber applicators, and these are going to be used while you're designing the brow, but they also can be used for applying secondary number, particularly the little microfibers. We have our pigment rings, and you always have the option of a ring that you'll wear on your finger, or you do have the option of a pigment cup. And one is not better than the other, it is just personal preference. And then lots of cotton rounds for holding in your hand, for blotting, for wiping pigment, and then for cleaning at the very end of the procedure. So this is what a basic tray setup will look like. Obviously, you might down the road be adding additional items to it as you begin to expand in your career, but this is what the basic should look like. Again, this will be removed before the procedure starts. Anything that is used needs to be disposed of immediately. You don't want to have your tray full of, pigment and blood, soaked cotton rounds. And then afterward, all of this has to be cleaned and disinfected as per the Department of Health.
Okay.